Hello and welcome. I'm Debbie Bergio. Welcome to Winter Grace Senior Ministries. Today we are joined by Shannon Spears of Shannon Spears Wellness. Shannon is a board-certified holistic health coach and a licensed ecclesiastical holistic practitioner. Shannon, we are so glad that you were here with us today.
Thank you, Debbie. I'm glad to be here. I always enjoy coming and sharing some information on your conference.
Thank you. And today we're talking about heart health, so this is just wonderful. And you're going to be sharing with us how to take care of our hearts naturally.
Yes, so very, very important, especially as we get older. Our hearts have worked for quite a while. They get a little tired, so to be able to nurture them naturally and give them some additional energy and oomph that they need as we get older, it's always a nice perk.
That sounds great. Well, I'm going to turn this all over to you, and I'm just going to listen and learn.
Awesome. Sounds good. All right. Hey, everyone. All right. So today we're going to talk about heart health. We're going to cover heart disease and what it is, how food and lifestyle impacts our heart health, and ways to improve it. And we're also going to talk about some education on strokes today, the different kinds of strokes, what to look for, and what to do. So if I can get my slide moving here. All right, so what is heart disease? To kick our event today, it's important that we're all on the same page when it comes to understanding what heart disease actually is. So according to Medical News Today, heart disease is the leading cause of death for both men and women in the US. It's also the leading cause of death worldwide. So heart disease is a term used to describe several conditions, many of which are related to plaque buildup in the walls of the arteries. As the flexibility of your arteries disappears due to chronic inflammation in the body, plaque builds up, your arteries harden and narrow, and this makes it more difficult for blood to flow and creates risk for heart attack or stroke. So you might be asking yourself, how does this relate to you personally? Well, let's move on to discuss who is at higher risk for heart disease. Is your heart safe? When we look at heart disease, it's important to know some of the leading causes to best understand how to reduce our risks in the first place. According to the American Heart Association, the following factors greatly increase the risk of heart disease: smoking, high blood pressure, high cholesterol, physical inactivity, obesity, hereditary genes, and unmanaged diabetes. The list of risk factors may seem a little overwhelming. It might seem like pretty much everything is a risk factor, right? But the good news is that numerous studies have offered solutions to lower your risks by implementing some manageable lifestyle and food changes, even if you're predisposed to heart disease through genetics. I've always heard the term, and it's so very, very true, especially when it comes to genetics and heart disease, is the genes hold the bullet, right? And the environment is actually what pulls the trigger. So the environment and your lifestyle choices is what pulls the trigger on whether or not those genes are enacted within your body. All right, so how to reduce your risk. The Food and Drug Administration has the following list of 3 main topics on their website for some general lifestyle changes you can make to reduce the threat of heart disease. Quit smoking, or don't start smoking if you haven't, but you're thinking about it. If you do smoke, consider seriously quitting by, contacting your health professional. There's many, many ways now that are available to help you quit smoking successfully and lower the reaction of your body to have those cravings. Okay. Smokefree.gov also has some great resources for quitting. You want to exercise regularly. Doesn't have to be vigorous exercise, but getting your body moving in general will help lower inflammation in your body. Maintain a healthy weight. Everybody is different. The weight may differ for everybody. I know we have our height and weight charts, but just because we have those doesn't mean everybody fits into those categories. So we just want to make sure that it's a healthy weight for us. Eat heart-healthy food choices. So a healthy diet and a healthy heart. And we're going to dive right in and we're going to discuss some food choices. Eating a heart-healthy diet is one of the leading ways to reduce your risk. When we eat a heart-healthy diet, this means you're going to eat lots of vegetables and some fruit with each meal. If you choose to eat meats, you want to choose the leanest cuts available and prepare them in healthy ways. You want to limit saturated fats and added sugars. A quote from Mark Hyman: "To think we can treat heart disease by lowering cholesterol, lowering blood pressure, and lowering blood sugar with medication alone is like mopping up the floor while we leave the faucet running and the sink overflowing." This clever analogy from Dr. Hyman really highlights the need to discover the outlying causes that put you at risk for heart disease rather than just treating your symptoms with medication. Your daily food choices are number one on this list. So a clean diet, such as something like the Whole30, the Mediterranean diet, or choosing just anti-inflammatory foods in general, are great guidelines for getting started on your path to optimal heart health. Ideally, you want to include a variety of fruits and vegetables, whole grains, staying away from white breads, white rices, things like that, full fat dairy products. Some of you may be shocked at that, but low fat, when we choose low fat dairy, it has a lot of added chemicals and sugar to make it taste good. Okay, the same thing with low fat milk and skim milk. They have to add things back in to make them tasty so you'll actually drink them. Skinless poultry and fish, nuts and legumes, which are beans, healthy low processed plant and nut oils like avocado, olive oil, coconut oil, walnut seed oil. When we think about whole grains, I'm going to go back to whole grains for a minute. Something that many people don't know is something as simple as 1 cup or a half a cup of white rice equals 11 teaspoons of sugar into your body. Because white rice is a very simple carb, it breaks down into sugar. There's nothing for your body to latch onto. There's no nutrients or anything like that in there for your body to absorb. It all turns to sugar. So the food list that I've kind of given you is just a general guideline. It's not relevant to everyone. It depends on what you've got going on. I would recommend that you seek out a functional nutritional therapist to help you with individualized nutritional needs. Notice I did not say a dietitian because dietitians generally follow the food pyramid that the government puts out, and that is not conducive to a healthy, heart-healthy lifestyle. Okay. So what's on the menu? Here's a list of some foods specifically that fit with the guidelines of heart health, okay? Things like wild salmon, not farm raised, but wild caught salmon, sardines, nuts, liver, chia seeds, oatmeal, blueberries, green tea, dark chocolate, the darker that you can stand it, the better, raisins, yams or sweet potatoes, whole grains, ancient grains, so quinoa, amaranth, things like that, apples, Brussels sprouts, oranges, avocado, it's got lots of healthy fats in it, and red wine. That does not mean to drink a bottle of red wine. It does mean that you can enjoy a glass of red wine, especially with a protein-heavy dinner. It helps with the digestion process of that as well. So what to ditch? Here is a list of some of the biggest things to ditch from your food choices every day, okay? These counteract having a healthy heart. These actually create more inflammation in your body and affect your heart and your brain directly. You want to steer clear of fast food burgers, deep fried foods, candy, soft drinks, sugar sweetened juices. 100% juices with nothing added are okay. Sugary cereals, cookies and pastries, margarine. Butter has always been a healthier option because it is natural. Meat lovers pizza because they have a lot of nitrate-filled meats on them, and those can create inflammation and directly affect the heart. Diet soda. And a lot of you may be surprised at that as well. Although we know soda isn't good for us, a lot of people in their mind tend to think, well, if I'm drinking diet soda, it's not nearly as bad. In reality, it's actually worse than regular soda. Your body can process sugar. Your body cannot process any type of artificial sweetener that they're using in diet sodas. It actually is a toxin to the organs in your body. Many functional medicine and naturopathic doctors believe that the cause of heart disease is high inflammation in the body. All of these foods that I've listed above cause inflammation in the body, whether the result is inflammation showing up as high blood pressure, high cholesterol, diabetes, or heart issues in general. So there are a lot of heart healthy unprocessed options for breakfast, both savory and sweet. So whatever you're craving, there's plenty of heart healthy recipes that you can find to help get you started. Some of my favorite websites to find heart healthy recipes are eatingwell.com, cleaneating.com, cookinglight.com, and tasteofhome.com. And the easiest way to find what recipes are heart healthy is to just type in the search heart healthy recipes. The biggest thing we want to look at when we're looking at the different areas, we're going to go through the different areas of the day that you would be eating. And really the biggest thing to focus on is that we're focusing on whole foods. We're not going out and grabbing the quickest, throw in the microwave type of dinners, meals, things like that to cook. Those are processed foods, okay? A whole heart lunch, for many of us, lunch is a quick, it's on the go meal. We often find ourselves reaching for some unhealthy options to quickly satiate our hunger. In effort to protect your heart, it's important to plan ahead for lunchtime meals so that you can be sure you're eating a heart healthy meal for every meal. For dinner, dinner is obviously an important meal. It allows us time to sit down, whether it's by ourselves, with a friend, with our family, and just decompress from the day. It should be the time to nourish our tired, work-worn bodies and our stressed bodies. Preparing dinner does not have to take hours, okay? In this day and age, you can definitely find some quick recipes online that take less than 30 minutes. You can also look at recipes that have less than 5 ingredients, or use some of the leftovers that you may have from the day before. An easy way to make dinner even quicker is to become very good friends with your Instant Pot or your crock pot. So with your crock pot, you can fix something in the morning, just throw it all together in there and turn it on and let it go while you're at work on low. And by the time you get done and you get home, everything is ready to go for you. It also helps to pre-plan your meals and pre-prep ingredients that you're going to use during the week for those meals. Now, just because we want to go with whole foods and we want a healthy heart rate, that doesn't mean that dessert is off the table. It definitely is still on the table. Thankfully, many people have made the move to healthy eating because there are countless healthy recipes out there to soothe that sweet tooth without a bunch of added sugar. Do not, however, make the mistake of switching out that sugar for those unhealthy artificial sweeteners. There's quite a few healthy alternatives to sugar, and there's no reason for you to make unhealthy choices like aspartame and sucralose. Now, better known, these usually show up under the names of Splenda, Equal, NutraSweet, things like that. We've all seen those yellow, blue, and pink packages sitting on the table at restaurants, okay? Those are in your store too. You want to stay away from them. These all create inflammation in your body, and as I said before, they are toxic to your organs. They cannot detox them. You want to choose better options like stevia, monk fruit, coconut sugar, and agave syrup. All of these, although there are other options out there that are natural sweeteners, these four in particular have low glycemic indexes. So if you are someone who has prediabetes or diabetes, these are good alternatives for you that your body can naturally process. Your taste buds and your heart will also thank you. Now, snacking is not out of the option either. It's important when you're trying to change your eating habits, especially for healthier foods, to always be prepared for those snack cravings that are going to come up and help to change the brain wiring for those sugary snacks you might reach for, right? By having something that's packed with some protein, packed with some healthy complex carbs to get you through those cravings. Without something at the ready for those midday and after exercise cravings, for instance, it's easy to fall off track and just grab something packaged, processed, and quick. All right, so we're going to switch gears here a little bit. We're going to talk about exercise. So we want to get moving for heart health. Exercise should always be part of a healthy lifestyle, no matter what type of health issues you are dealing with. But if you're wanting to target your healthy heart, there are some specific exercises that are recommended for reducing your risks. Strength and resistance training is one of the biggest ones. The American Heart Association recommends strength training exercises at least twice weekly. This includes push-ups, squats, sit-ups, jumping jacks, those cardio-inducing type of exercises. Even if you can't do some of these movements, there are modified ways of doing them that are still going to give you some cardio responses that you want, make your heart stronger. You can also do exercises with resistance bands. So when we talk about our heart, right, we think about doing all these cardio movements in the gym, but when we're working things like our bigger leg muscles, okay, those are directly affecting how our heart is working as well. So doing resistance band workouts with those larger muscles and even with our arms, we're getting moving, we're inducing a sweat, and therefore we are making our heart work. It's pumping a little bit harder while we're doing that workout, okay? Resistance band exercises are really great for strengthening bones, muscles, and connective tissues and helping to lower the risk of bodily injury. By increasing your body's muscle mass, which can be more difficult as we age. So if you get started now, you have a better chance to increase your body's muscle mass, and you're increasing the amount of calories your body burns, which helps you also to maintain a healthy heart and a healthy weight. Now, another option is walking and running. Walking is a low impact exercise that's easy to start and then build up to more sustained movements like jogging or running. Walking is great for lowering our blood pressure and cholesterol while increasing energy and preventing weight gain. Yoga is also a great exercise with proven mental and physical benefits. Now, I know some people kind of get irked at the word yoga, right? But for me, as a Christian, yoga just means that I'm stretching my body, I'm opening up my joints, I'm allowing more blood circulation to get to things that may not be getting to my arms and legs because I'm sitting at a desk for long hours during the day. Yoga does not have to include all of these different meditations and things like that that we typically see advertised doing with yoga, but to just get our body moving and stretching in ways that we normally wouldn't during the day, so that it gives us increased flexibility, allows us to start building some muscle tone as well. So if cardio is not really an option for you, doing stretches like yoga stretches is really going to help tone some of those muscles still as well. And it helps to give us a nice sense of well-being as well as balance. I always use, yoga time to focus on prayer as well, and that quieting my mind. If you want to take a look at some yoga poses to start with, you can jump on YouTube and do a search for yoga poses. Find something that's going to fit what you want. Yoga Online, the Yoga Journal Online, also has some great beginner movements that you can use as well. All right, let's talk about some myths that we hear when we talk about heart health. Most of us have heard some information surrounding heart disease, and of course, there's always the naysayers or just questions that surface when considering our health and the accompanying recommendations. So I want to look at a few more commonly believed myths and discuss why those aren't credible. So this one's often heard: heart disease is something only older people should worry about. This is false. According to the Mayo Clinic, all of us should take heart disease seriously. There are risks even for younger people based on family history and lifestyle. We're seeing a lot of obesity in younger kids now, and many more teenagers, kids and even young adults are now at higher risk for heart issues after COVID as well. The myth of reversal. So one of the things that is commonly said is if I'm a long-time smoker, I can't reverse the damage I've caused my heart or reduce my risk of heart disease. This is false. Research done at Harvard Medical School states that quitting smoking has immediate benefits no matter how old you are or how long you've been smoking. Those benefits start the moment that you quit. After just 1 year of not smoking, your risk of a heart attack reduces by 50%. After 10 years, the risk drops to that of a person who never smoked. There are plenty of options out there today to help you quit smoking, so contact a medical professional to help you find the tools that are going to be right for you. So the myth of genetics. We talked about this a little bit at the beginning of this presentation, but one of the biggest things is I am only at risk for heart disease if the genetic predisposition runs in my family. Again, this is false. Genetics can play a role in developing heart disease, but 90% of heart disease cases are the result of lifestyle choices. This includes smoking, poor food choices, lack of exercise. It's often these lifestyle choices that can raise the level of cholesterol or other harmful fats in your blood, which can then increase your blood pressure, cause type 2 diabetes, both factors for heart disease. The lifestyle changes that we've highlighted here today can even reduce the risk of heart disease when it comes to that genetic risk. The myth of shortcuts. If I can just take an aspirin a day to stave off any heart trouble, including heart attack and stroke, then that's what I need to do. This is false. So aspirin has been known to reduce the risk of heart-related complications. But as of 2021, there are new updated guidelines for taking aspirin for heart health. According to the updated guidelines, if you've never had any heart-related problems or events like a stent or a heart attack, you have an increased risk of bleeding, or you're over the age of 60 and aren't already taking a daily aspirin, you should not start taking it now. According to the American Heart Association, most people should not take aspirin because the bleeding risks many times counteracts any any benefit that it would have on a heart attack or stroke prevention. The bleeding that happens with taking an aspirin every day can be in the gastrointestinal tract, or even more seriously, bleeding can occur in the brain. So a lot of times when we think about this, in general, we're like, well, that just means if I get a cut that it's going to be harder for me to clot. But that's not true. It's the internal bleeding that they worry about. Aspirin has an antiplatelet and anti-clotting effect that can keep heart patients' arteries open, which is the reason why it can benefit someone who already has heart disease, but yet can be a very dangerous option for those who don't. So it's very important to contact a health professional to first determine if aspirin treatment is right for you. And if it is, what amount would be safe and effective for you. There's also a lot of natural supplements out there that can do the same thing that aspirin does with much less side effects and without the risk of bleeding. The FDA recommends informing your health provider of all the medicine and supplements that you take if you're considering doing the aspirin regimen, because your risk of bleeding may be higher if you use aspirin while taking certain medications, vitamins, or herbs. All right, let's talk a little bit about our kitchen and the spice cabinet that we have. So stocking your heart healthy spice cabinet. Many spices that we use have anti-inflammatory effects on your body, including your heart. The following herbs that I'm going to talk about and spices are great heart healthy ways to add some flavor to your meals, and they're all anti-inflammatory. So let's see, I'm going to go through this list. I'm going to go through a little bit slowly so you guys can write it down if you want. We've got allspice, basil, bay leaves, black pepper, caraway seeds, cayenne, chili powder. Some of you are probably familiar with an herb called Chinese 5-spice, cinnamon, cloves, coriander, cumin, and curry powder, dill, garlic, ground ginger, Italian seasoning, marjoram, mint, nutmeg, onion powder, oregano, paprika, and parsley, red pepper flakes, rosemary, and then we also have something like Bragg's aminos in place of using high sodium soy sauce. Okay. Now, as we go through that list, you'll notice like coriander. Coriander is seeds from celery. The seeds themselves are anti-inflammatory, which means celery is also anti-inflammatory for the body. Same thing with onion and garlic. We know onion and garlic pretty much. If you've listened to any of the past webinars that I've done here at the summit, they are anti-inflammatories too. So it makes sense that their powdered forms would be anti-inflammatory. So think about some of those things in your cabinet that you have, those things that you like to cook with every day. When using herbs like rosemary and thyme and basil, things like that, it's best to use them fresh, but if all you have is dried, that works as well. One of the biggest spices that you can incorporate into your daily regimen is turmeric, okay? Turmeric is considered a great alternative to aspirin due to its naturally occurring anti-inflammatory properties. It's the active chemical in turmeric called curcumin that is responsible for reducing the inflammation. Curcumin, according to Curcumin for Health Online, is a great option without the potentially life-threatening side effects of certain medications. Curcumin is also known to reduce the spread of any inflammation in the body safely. You can incorporate this into your diet by adding turmeric into many recipes, including soups, dressings, curries, teas, scrambles, juices, and smoothies, and even nut milks. You can look up a recipe for golden milk, and golden milk is going to be the combination of turmeric, a little bit of honey, a little bit of cayenne if you prefer, as well as any type of nut milk and warmed up. A lot of times it's drank after a meal or before bed. It's very relaxing as well. Okay, so let's transfer a little bit. We're going to talk about strokes. So what is a stroke? A stroke happens when blood flow to an area of the brain is cut off. Blood carries oxygen to cells in the body, and when those cells aren't able to reach the brain cells begin to die. The stroke is a medical emergency, and it's important to get treatment as soon as possible. Some treatments only work if given within the first 3 hours of symptoms happening, and a delay in treatment can increase the risk of permanent brain damage or death. So let's take a few minutes and let's look at the different kinds of stroke. There's 3 different main types of strokes. The first is the ischemic stroke. It's also known as a stroke caused by a blood clot, which accounts for about 87% of all strokes. An ischemic stroke occurs when fatty deposits lining the walls of blood vessels start to obstruct blood flow. There are 2 types of obstruction that can occur. One type of obstruction that can occur is called cerebral thrombosis. And this is, this occurs when a blood clot forms in the brain's venous sinuses, which is a channel between the veins and your brain. It prevents blood from draining out of the brain. As a result, the blood cells can break and they can leak into brain tissue, which forms a hemorrhage. This type of stroke can happen in people of all ages, including children, even newborns. The second cause of an obstruction is referred to as a cerebral embolism. This is a blood clot that forms at another location in the circulatory system, usually the heart and large arteries of the upper chest and neck. And the stroke occurs when part of the blood clot breaks loose, enters the bloodstream, and travels through the brain's blood vessels too small to let it pass. A leading cause of embolism is an irregular heartbeat, which can cause clots to form in the heart, dislodge, and then travel to the brain. The next one is hemorrhagic strokes. Hemorrhagic strokes account for about 13% of stroke cases and are caused by a weakened blood vessel that ruptures and bleeds into the surrounding brain, thus accumulating and compresses the surrounding brain tissue. 2 types of weakened blood vessels usually cause hemorrhagic stroke: aneurysms and arteriovenous malformations, or AVMs. However, the most common cause of hemorrhagic stroke is uncontrolled high blood pressure. An aneurysm is a weak area in a blood vessel that usually enlarges. It's often described as a ballooning of the blood vessel. They expand slowly and become weaker as they grow, just as a balloon becomes weaker as you stretch it. People usually aren't born with aneurysms. They can form from blood vessel disorders, infections, drugs such as amphetamines and cocaine, or direct brain trauma from an accident. If one aneurysm forms, there's about a 20% chance that at least one other one will form as well. Small aneurysms don't have any symptoms, but as it enlarges, it can produce headaches or localized pain. As it expands, it can create pressure on the healthy brain tissue or adjacent nerves. Typically, arteries carrying blood containing oxygen from the heart to the brain, while veins carry blood with less oxygen away from the brain and back to the heart. When an arteriovenous malformation, or an AVM, occurs, a tangle of blood vessels in the brain bypasses healthy brain tissue and directly diverts blood from the arteries to the veins. Brain AVMs occur in less than 1% of the general population. They're more common in males than females, though. Usually someone is born with an AVM, but they're not inherited from parents and likely are not passed on to children. As the heart beats, it pumps blood around the body through a network of vessels called arteries. So muscles can get energy and oxygen that they need. And as blood travels through arteries, it pushes against the sides of the blood vessels. The strength of this pushing is called blood pressure. As your heart squeezes and pushes your blood through your arteries, your blood pressure goes up. As your heart relaxes, your blood pressure goes down. With each heartbeat, your blood pressure will rise to a maximum and fall to a minimum. This duo of numbers is shown as one number over another, which translates into the blood pressure reading you get at your doctor's office. High blood pressure can significantly increase the risk of hemorrhagic stroke because it means your heart is under more stress. It's working harder to transport that blood from one place to another. Men, elderly, and people who smoke, people who drink alcohol, coupled with high blood pressure, are at a drastically higher risk of having a hemorrhagic stroke than anyone else. And the last one that we're going to talk about today is the TIAs, transient ischemic attacks. These are also known as mini strokes. A TIA is a major warning that your body's not functioning at its best and that a full-blown stroke is ahead soon. TIAs occur from a temporary blockage of blood flow to the brain, but the body fights back quickly by pushing the TIA back downstream or by using natural clot dissolvers. Therefore, the blockage isn't in place long enough to do any damage, which is why it's a warning sign. Here are some statistics about TIAs that you should know. A TIA happens before about 15% of all strokes. Up to 25% of people who suffer a TIA die within 1 year from a major stroke. And about 1/3 of people who have a TIA go on to have a more severe stroke within 1 year, even if that doesn't mean death. Anyone can have a TIA, but the risk increases with age. If you previously had a stroke, pay very careful attention to the warning signs, which are the same as a stroke, and think fast. So, act fast. There are 4 major signs of a stroke that you should be able to recognize. FAST is an acronym, and it stands for face drooping, arm weakness, speech difficulty, and time to call for help. So with face drooping, you want to ask the person to smile. Does one side droop? An arm weakness, ask the person to raise both arms. Does one arm drift downward on its own? Speech difficulty, ask the person to repeat a simple sentence. Are their words slurred? And T, if a person shows any of these signs, then it's time to call for help. Call 911 or your local emergency hotline. All right. More symptoms to look for. The FAST test that we just covered is the most common symptom. It covers the most common symptoms of stroke. But other sudden symptoms that someone is having a stroke might feel include the following: numbness or weakness in the face, arm, or leg, especially on one side of the body. Confusion or trouble understanding other people, difficulty speaking, trouble seeing with one or both eyes, problems walking or staying balanced or coordinated, dizziness, severe headache that comes on seemingly for no reason. When we're dealing with stroke symptoms, every single minute counts. Calling a doctor or driving to the hospital yourself just wastes valuable time. Ambulance workers can judge your situation sooner, which boosts your chance of getting the potentially life-saving treatment that you need. If you notice any of the symptoms that we've discussed here so far, call for an ambulance. Even if you're not sure, it's definitely better to be safe than sorry. Okay, So let's celebrate your newfound heart health that you are going to take action on. We've covered a lot here today, and you might be feeling a bit overwhelmed, but you got this. You can go back and you can listen to this information and take some more out of it, take some more notes. You came for a reason to make more informed, healthier decisions when it comes to the health of your heart, the decisions that are going to be right for you and your lifestyle. When you do this, you're on your way to making a difference in your life. And my hope is that the education I provided you today is just what you needed to get started. One important factor, important thing to acknowledge is that getting accurate information is always the first step towards better health. In and of itself, it's not capable of improving your health, but instead action is needed once you've learned the education to take those steps to live a healthier and happier life with healthier and better food and lifestyle recommendations. So I want you to take a few minutes after listening to this class and just take a moment for some self-reflection and ask yourself, what daily actions can you commit to now to ensure that you're going to be supporting your best heart health as you move forward in your life? Okay. And for a little bit more information on me, if you want to connect with me, you can go to my website, shannonspearswellness.com. You can also email me, shannonspearswellness@gmail.com, and just put in the subject line, heart health, and I will know that you are coming from Debbie's conference and that you watched this slide and that's what you have questions about. So I have enjoyed my time here today with you all, and I hope that you've enjoyed the education you received as well.
Shannon, thank you so much. Wow, so much information. I love the fact that no one step is really hard.
Yeah.
That just encourages me. Like, and you can take steps. It doesn't have to be all at once.
Yeah. It doesn't have to be complicated. I think we get overwhelmed with information coming at us from Google, from commercials on radio, on the TV, magazines, right? Like we have all of this information coming at us. So that's why I wanted to do this today, to really pinpoint just the basics. This is the basics you need to focus on, right? And then decide what's right for you.
That's great. And you are a health coach, holistic health coach. So can you just share for a couple minutes what that means so folks know that they can contact you to and
absolutely.
I want to say take advantage, but that's not right. But learn how you can help people work through these changes.
Yes, absolutely. So being a holistic health coach, it is my job to give education where education is needed. I have many of my clients, what they're going through health-wise, whether it's heart health, it's diabetes, it's inflammation, it's autoimmune disorders, anything like that, right? They're coming to me because they're not getting answers from their doctor. They have a lot of questions. They're tired of just being thrown a prescription and that's it, right? So when you come and work with me, it's all about that education. It's all about learning how to take back control of your health and digging into those holistic, God-given natural ways to improve your health. And that goes through your lifestyle choices and your food choices, focusing on, how we're relating to stress and dealing with stress in our life. What is our sleep like? What are our food choices like? Are we moving? Do we find joy and happiness in our life? What's our spirituality like? Things like that. These all have a big play in the foundations of our health. So it's bio-individually tailored to your specific personal needs. So no one recommendation that I give is given to everybody in general. It's all according to what you need, what you're going through, what your health issues are. So it's definitely not generalized. It is all about your bio-individual needs.
And I just love knowing you and having worked with you for a few years now, that your research is outstanding and thorough, and your way of working with people is absolutely lovely. So just thank you so much for sharing with us. And I hope that if you have anyone who has questions will reach out to Shannon and get connected. So thank you.
You're welcome. It's been a pleasure.
Great.